Hello, everyone. Welcome to our series of podcasts. Today, we are talking about the capacity building for telemedicine and digital health. Uh, Most of you know me. My name is Dr. Sharik Koja, and I'm facilitating this series of podcasts. I am the CEO of Tech for Life Enterprises. Um, I have with me the expert, as expert of the day, the person who has loads of experience in capacity building and digital health, an old friend, Dr. Georgi Chaltikian. Uh, Dr. Georgi is professor and head of digital health at European Campus Rotterdam, a branch of Dagendorf Institute of Technology in Bavaria, Germany, the founder and head of Research and Education Center of Digital Health at Russian Armenian University, and the founder and chairman of Armenian Association of Digital Health. Dr. Georgi is a graduate of Yerevan State Medical University in Armenia. He has been trained as a general surgeon and spent about 20 years in clinical practice. He has extensive experience in healthcare education, research, and management. He has more than 15 years of work experience in the field of digital health. Professor Chaltikian is the program head of the Masters of Digital Health, a double degree study program at DIT-CRI in Germany and RAU in Armenia. He leads international collaborative projects and programs, such as the partnership with HIMSS, has publications on different aspects of digital health, and is a keynote speaker and moderator at international conferences. His main research focus is on digital health education and workforce development, digital health policies and strategies. He also is contributing in the field of artificial intelligence for health and personalized health. We welcome Dr. Georgi to this podcast as an expert.
Thank you very much. Thank you. Good to see you. Good to participate in this. Thanks for inviting me, Dr. Shai.
Thank you. Thank you so much. So, Georgie, before we discuss today's topic about capacity building, I'm sure our viewers would like to know from you directly about your remarkable journey in telemedicine, digital health. We have been talking about it for a long time, but it would be great that we can get a recap and our audience can also hear from you about your key initiatives and what impact have you produced in Armenia and outside in other countries.
Mm-hmm. Yeah, thank you very much, Dr. Sharik. Well, thank you first of all for this generous introduction. You already basically mentioned the main milestones of my professional career. I was essentially, my background is a medical doctor. As you've mentioned, I was trained as general and laparoscopic surgeon, and I have spent a couple of decades in medical practice as well as in education and research as an associate professor of surgery at Yerevan Medical University in Armenia, Armenia's public medical school. However, sometime in mid 2000s, 2006, 7, I became very interested in health information technologies, and that basically led me together with my colleagues to establish the Armenian Society, Armenian Association of Telemedicine back then. I have to say that about 2 years ago, we've rebranded and renamed the society actually into the Armenian Association of Digital Health, AADH,
Mm-hmm.
yes. And it is since basically 2008-9 that I began my journey in the domain that we currently like to call digital health, as a wider domain. So we've conducted a few projects in Armenia, also international. Then fairly early we began collaborating with a number of international actors, with major global think tanks, like ISFTH. I think we actually met through the ISFTH network for the first time. So as I remember, back in 2009 probably. So quite some time ago. And then eventually we also began collaborating with academia institutions, notably with this Deggendorf Institute of Technology, which is a University of Applied Science in Bavaria, in Germany. And eventually, it was that collaboration that brought me as a tenure track professor to DIT, where I have been leading this master's program. And it would be probably interesting to mention that this master's program has also evolved sort of with following these recent developments, including the wording and terminology developments, right? Because initially the program that I was invited to lead back in 2015 was named Master of Medical Informatics. And it had essentially been always been rather an e-health study program. And then eventually, a few years ago, I modified the curriculum a little bit and renamed it also in Master of Digital Health. And this is what we do currently. And then I also, we managed to establish interinstitutional agreement between Deggendorf Institute of Technology and one of Armenia's most established and high-ranking universities, this Russian-Armenian University. We call it RAU in Yerevan. And eventually we were able to launch the same MDH program also in Armenia as a double degree, meaning that we have students who enroll in Germany, we have students who enroll in Armenia, and some of them then can go for additional, not traditional, but we can take some semesters, let's say students from Armenia coming to Germany and vice versa. And these students eventually, they get two diplomas, one diploma from Armenia and one diploma from Germany. So essentially become internationally recognized digital health specialists. So this is the big part of my activities. Of course, although I am essentially an expat, mostly living and working in Germany, but I retained very significant connections also with my homeland, with Armenia, obviously, through the association. A few years ago, actually about a year ago, we elected a new executive board at the association. So there are new colleagues and friends now leading the society as president and executive board. However, I retained a position as chairman of the board. And with the association, we continue supporting Armenia's journey towards digital health, digital transformation of the healthcare.
Wonderful, extremely exciting. The last we met, and we had talked when you were in Armenia and were working both at your institution and with the Armenian Society of Telehealth. So tell me, with your earlier part of the career when you got involved in digital health, before moving to Germany, were there any capacity building, educational research programs that you were also involved in Armenia and started from there, the journey of capacity building?
Yes, yeah, absolutely. The very first major activity that we undertook as Armenian Association of Telemedicine, it was back in 2009, 2010, and it was actually a telemedicine project for primary care. The project connected a few primary care facilities in rural Armenia to a hub, to a center in Yerevan. The entire system was set up by our society, by our team, and operated throughout several, actually up to 6 weeks. For that particular pilot that was co-founded by USAID. And an important part of that project, and even the title of the project itself, was capacity building for telemedicine outreach to primary care facilities in rural Armenia. So a very important part of that project and was training awareness and education of these primary care staff working at these facilities in rural Armenia. And back at the time, we have to say that even though Armenia is commonly mentioned as one of the earliest pioneering experience in telemedicine, which dates back to 1988, 89, actually. Back at the time when there were just, 1 to 3 telemedicine experiences worldwide. And because of a tragic event in Armenia, a major earthquake that took lives of no less than 25,000 people in 1988, back then, NASA and some healthcare institutions and academic institutions in the United States, with the support of NASA, provided a satellite connection to Armenia and supported Armenian doctors with providing care to casualties of that dramatic earthquake. So it was 1988, 89. That was obviously a project mostly conducted and thanks to the connections between Armenian diaspora in the United States and the US institutions and NASA. However, that experience had been there a long time ago. Of course, despite that, however, in mid-2000s, 2007, 8, 9, when we began our activities, very little telemedicine health had been there in Armenia. Also sporadic and isolated experiences. And of course, much of our activities has always been trying to increase that awareness and also trying to essentially to demonstrate the capabilities of telehealth, telemedicine, and other digital technologies to healthcare providers. So building capacity, doing training has always been a very important part of AATM's and then now AADH activities. And after that first pilot, there were other projects, including training. We have conducted several focused training for primary care as well as for hospital staff, hospital personnel, demonstrating them, also teaching them telemedicine. Of course, we also organized in 2011 the very first in the region, even beyond Armenia, dedicated Congress of Telemedicine and e-Health in 2011. And that was in and by itself, of course, also a capacity building and teaching experience, including a workshop that was developed at the time of that conference. And since then, we organized also a series of educational and R&D events in Armenia. And of course, eventually we came to this major degree program that is designed specifically to foster, to generate digital health workforce in Armenia in order to support the digital transformation.
Coming to this master's program, which is so exciting. I mean, there are so many different graduate programs now coming in. Health informatics, medical informatics with different foci. But just looking at the title Masters of Digital Health, that's so innovative in itself. And then as you were describing, this program is not limited to one campus, in fact, multiple campuses in different countries and all that. It's so exciting. So just tell us a little more about this program. Since you said it started as a master's in medical health informatics and then grew into digital health. So how that journey has been and how the vision has changed, which is directing the whole program.
Yeah, absolutely. Thank you for that great question, Dr. Sharik. Yes, we began indeed as masters in medical informatics back in actually 9 years ago in 2015. And I have to say that back then I started that program with a class of 6 students. This year, 2024, we received 1,810 applications for entry into this study program from all over the world. I have to say that this program is taught exclusively in English. So quite naturally, it is very popular among major, big English-speaking nations because it is international. We enroll international students, many students coming from South Asia, from India, Pakistan, Bangladesh, but also from major African English-speaking, native English-speaking nations such as Nigeria, Kenya, Ghana, and basically also all over the world, also from other parts of the world, from Asia Pacific, from Africa. I mean, actually, we have students from nearly 110, if I'm not mistaken, nations now on our campus. So it is very international. And as to the rebranding and renaming, I believe, and my vision actually has been, and my passion, if I may, recently has been specifically developing, harmonizing curricula and developing the educational approaches in the wider domain of digital health. And why I decided to depart from the title of Master of Medical Informatics to digital health, that reflects my own understanding of the not frequently mentioned, but in my understanding, important slight differences between medical or health informatics, biomedical informatics being a scientific discipline and a digital health being, according to the WHO definition, a domain of knowledge and practice that is not only limited to health informatics or to information science per se, but includes a lot of additional knowledge, skills, and competencies in such fields of obviously health sciences and medicine, but also in business sciences, in social sciences, in research and development, and even in business development and entrepreneurship. So since the scope has been expanding, and we have witnessed somehow also an evolution of that domain from. So on the one hand, there is the scientific disciplines of medical health informatics, or a wider discipline of biomedical and health informatics. On the other hand, there are the practical domains of knowledge and practice that used to be telehealth, telemedicine, right? The very first application of information communication technologies in medicine. Then it subsequently evolved into e-health, right? 90s we already were talking e-health. Then later came m-health, and eventually we decided. I mean, the WHO also promoted and somehow shifted or switched from the term e-health towards the umbrella domain term digital health. And it is my conviction, and not only my, obviously, I know many other experts who share that idea, that it is indeed a digital health education, and not necessarily limited, or not limited to degree education, but also digital health capacity building, or as we frequently say recently, upskilling and reskilling of health workforce in digital health, that is of utmost importance for supporting the digital transformation. That is why here comes my idea that as to MDH, Master of Digital Health, I have been and I am currently advocating for bringing together major academia actors, major schools that provide digital health degree education, especially at the master's level, and eventually harmonizing and in a way even standardizing the digital health master's curricula in order to eventually achieve a recognized and more or less standardized degree, MDH, pretty much in the same manner as we now have, let's say, MPH, right? Master of Public Health, which is, what is it? It is a result of several major schools of public health, essentially, coming together, standardizing the curriculum, and then standardizing the accreditation process. As a result, we now have this MPH that is essentially a proxy or a symbol, if you wish, a label of specific standardized, streamlined, and quality controlled education in public health. And my essentially vision and very high on my agenda is achieving the same regarding MDH. So as our students eventually are able to have that as a recognized designator, degree designator, like Miss Amanda Smith, MDH, pretty much in the same manner as we now have, let's say, MD, MPH, right, or MD, PhD. That is essentially my vision, and that's what I'm right now working on.
Amazing. So that must have required a lot of effort, because it's not just changing the vision and the name of the degree. Your whole faculty, your whole research agenda, your whole plan has to be evolved from one focus to another. So must have required a lot of work on your part and the team.
It has not happened overnight, obviously, Sharik. As we understand, it has been kind of a gradual transition. I remember myself very clearly already in 2015, 16, we've already been mentioning and communicating our study program as a degree program in digital health. I mean, that sort of that shift from other, even other words, used to describe the domain and towards digital health, it took place mostly in the in mid second decade of the 21st century, I would say, roughly towards 2014, 2015, and thereupon, right? And especially with WHO publishing their high-level strategy documents around that time, 2015, and then all the way until recently, including the Global Digital Health Strategy of 2020-2025. And here I have to say also that we are very honored and happy to collaborate with the WHO, and most especially with the Data and Digital Health Unit of the WHO Europe headquarters, the European office of the World Health Organization. So following that terminology transition, but we always say that it's not merely a terminology, because even nowadays, of course, we know that a lot of people, especially outside academia, they still use many of these words, let's say, interchangeably, right? Absolutely. People oftentimes say e-health, as a synonym to telemedicine or telehealth, or digital health as a synonym to e-health. Now, to us in academia, each of these terms has kind of a little bit of that. I mean, you being yourself in academia definitely know perfectly what I mean. But that transition to digital health as an umbrella term, according as it is mentioned in the WHO documents, and I think this is all important, that this novel sort of terminology or novel wording, it was reflecting also the changing, the evolving domain, especially with artificial intelligence, right? With Internet of Things, with IoT, IoT, with all these, data science, data analytics, and that is, and with major move towards consumerization, right? A digital consumer or digital citizen and citizen engagement. And these are the factors that we always emphasize. And that is why we decided that let's no longer call it e-health and call it digital health. Not obviously not saying that e-health is no longer there, not at all. To me, for example, now e-health is that part of digital health which is more focused on hospital or health information systems. Like, for example, electronic health record, health information exchange. I consider it being, in my understanding, kind of the domain terminology. To me, that is e-health proper. While digital health, in my understanding, includes all the variety and this broad spectrum of different other technologies, including the digital therapeutics, including the artificial intelligence, data science, and of course, all of that eventually leading to the so-called personalized health, something that I like to call 10P health. Mm-hmm. Personalized, precision, proactive, predictive, platform-based, and so on and so forth.
Wow. Very interesting. Thank you. So while you are promoting this great concept overall, and at the same time through this institution of yours, you're promoting the research and the capacity building of like many new providers, not new experts, which are not only working in Europe but globally, as you mentioned. What is your interaction outside the academic world, like with the governments and other practicing organizations, to really see these people making an impact in the practical world as well?
Yeah, excellent question. Thanks for that, Dr. Shak. Well, obviously, this has been from the very beginning, I have to say. The moment we established the society, even 15 years or 16 years ago, one of our priority has always been trying to bring together different actors and different stakeholders in the domain of telemedicine and e-health back then, and now even wider with digital health. And everybody knows that telemedicine, e-health, and eventually digital health, it is truly interdisciplinary. It is multidisciplinary domain. So the very important a huge amount of our effort at the association, speaking about Armenia, has been and is right now directed towards trying to bring together all these key actors, be it academia, be it healthcare providers, be it health professionals, be it governmental authorities and regulators, payers, as well as industry, of course, companies, startups, and wider public. And it is absolutely a critical factor. According to also all these strategy documents, the WHO has made it absolutely clear that it is impossible to achieve or to follow, to continue digital, or even to initiate digital transformation of healthcare in a nation without wide cross-stakeholder, inter-stakeholder dialogue and a multi-stakeholder representation. I have to say that there have been a lot of challenges on that way. We're still facing challenges on that way. Right? We have to understand that journey is probably not only in Armenia, but also elsewhere. I mean, I've witnessed a lot of that also here in Germany, in other European countries, in other countries around the world. We understand that there might be various conflicting interests. People are oftentimes have different motivations other than, let's say, a pure societal benefit, right? A benefit for all, which is definitely a motivation of myself and all of us at the association and the units that I'm honored to lead. But yes, it is challenging. We don't lose our optimism and we don't lose enthusiasm, and we're still and we continue campaigning, we continue calling for all these different actors, approaching them, as we always say, with open hand, and inviting them to collaborate, to synergize, and to together to move the field forward for the sake of eventually wider communities and all people of Armenia, and not only in Armenia, obviously, but elsewhere in the world.
Thank you so much, George. It has been a wonderful discussion and very fruitful. I think we've gotten a lot of valuable information, knowledge from you, and I'm sure audience have also benefited from all your work that you have done, starting from the primary healthcare level capacity building of health providers in Armenia to where you are now leading a major graduate program. And what a transformation, as you mentioned, the whole concept change that you talked about from medical informatics to digital health and how you differentiated between different areas within the digital health domain was extremely, extremely interesting. And your vision of having the Masters of Digital Health, MDH, being recognized as a degree in healthcare and a public health as a major qualification, I think that is something that many other academic programs in the world could learn from and collaborate on with you on that as well. I think that is something which would require a much broader uh, collaboration to really make
Definitely.
that happen. And your comments about the multi-sectoral collaboration to really make things work and the challenges that you have faced were really eye-opening. Anything else that you would like to emphasize, Georgie, that I may have missed in the summary?
Yeah, well, yes, I would say that I think we always say that it is just impossible not to understand that the future of health is digital. I mean, Dr. Tedros, the Director General of WHO, has just stressed it very recently at the 75th General Assembly. Everybody knows that. I have another very good friend of mine, colleague of mine, Professor Rajendra Gupta, who used to say that if you're not into digital, then you're not really into health or healthcare. And I cannot overemphasize that. I think we all understand that digital health and AI, artificial intelligence, in particular, will bring about tremendous change, tectonic shifts to health care, wellness, and I would say to the very fabric of life and human civilization. I am absolutely convinced that there will be a completely different paradigm in a couple of decades from now of the truly 21st century health and wellness that is based on digital data coming from various sources and being analyzed, processed by AI and AI navigators guiding everybody's journey in health and wellness. This is truly my vision, and I think, given the challenges also on that way, making it available, making it safe about AI, right, and making it no less important, affordable to everyone, right, to avoid what we call
So
a
important,
digital
yeah.
divide, right. And I believe it is primarily our responsibility, that of digital health experts, to, and of course our students. Like I always tell them, guys, you are the future leaders, the champions who are going to drive this transformation, and it is our joint responsibility to help societies, to help health systems navigate those challenges. And here, the role of education and capacity building obviously cannot be overemphasized.
Thank you. Um, these were wonderful ending remarks, Dr. Georgie, and on behalf of Tech for Life and our audience, I really want to thank you for your time today. and sharing your wonderful thoughts and ideas with the audience. I'm sure they'll benefit a lot. And to the audience, please feel free to share your ideas, your comments, and questions with us as well. And if there are any questions specific, especially directed to Dr. Georgie, we'll definitely send it to him and we'll try to get some answers for you as well. So thank you very much, Dr. Georgie, again for joining
Thank you
us.
so much for having me. Thank you. It's been a
Thank you.
pleasure. Goodbye.